O'clock. Welcome on a Wednesday to the ACSA Legislative Lunch Break, along with Edgar Zazwata, ACSA Senior Director of Policy and Governmental Relations. I'm Naj Alikhan, ACSA Senior Director of Marketing and Communications. Welcome. We are honored to have you here on the show today. Go ahead and jump into our chat, say hello. Let us know where you're watching from, what's happening in your region. Edgar, how are you today?
Hanging in there, Naj. It's another busy week. I know, and again, this is the theme, especially over the last 18 months. It's when our members have been real busy. I know that percolates up here, and been busy on this morning, just taking member phone calls on one issue or another. A lot of the unfortunately challenges that we're seeing now with people very excited about school coming back and kids returning to campus. But in this environment we're in, it's preaching to the choir here hasn't been easy always for our members and for the families.
Yeah, certainly hasn't. And I think if last week's show was any indication, because again, the governor is helping us out with our scheduling by breaking news, around 11 o'clock before our show. The fact that we went till almost 2 o'clock with questions really does show how many questions and concerns there are, even today, with you and I fielding phone calls and everything about last week's announcement of the vaccination mandate. So a lot to cover today. We've got a site administrator and a County Office of Education medical expert here on the show today. We'll talk to them a little bit later on. Just want to say hello to Dave Bowling is here, Morgan and Jason and Philip. So good to have you guys. Sheldon Smith was our first viewer on the chat today, and Thomas Addington. Edgar, I want to address just a couple of things. We had an article today that's published from the Sacramento Bee. This is a quote from Dr. Dean Blumberg. He's the chief of pediatric infectious disease at UC Davis Children's Hospital. Said the hospital has seen an influx of young COVID patients since July. He said, quote, "I think we need to be prepared that we might have some setbacks. But I am hopeful with proper protocols in place, we will have limited transmission in school settings." But I want to point this out, Edgar, because this kind of gives us maybe an opportunity to set this up a little bit. Again, this is from the Bee, from today's edition of the Bee. A recent report by the American Academy of Pediatrics and the Children's Hospitalization Association found that COVID-19 cases among children and adolescents under 18 increased 421% from early June to late July in California. Edgar, that is a startling statistic right there, and obviously one that has got to be a concern for our members and probably part of the conversations you're having this week.
Yeah. I mean, I saw in the comments a few members talking about contact tracing, right? And I think this is something that all of our schools are experiencing now, about just exposure. And I in talking to a number of our district leaders today, just saying that there's not a campus or a district where you're not having some positive tests, right? Now, the positive part is that we're still forging ahead. I mean, a year ago, even before that, I mean, that was all grounds for, okay, we're shutting down. We have some cases. Obviously, the science has evolved here. Now, I know there's some controversy even now, depending where we're at, what part of the state, on how we're dealing with those cases. Yes, I think that there is growing concern, I think it is appropriate to say, about what the number of cases we're seeing in youth, even more so the hospitalization rates. Now, with that said, as we're reminded many times from the experts, that a lot of the percentages, the proportional amounts are going up because they are the one last big sector of the population that's not vaccinated, right? I think that coupled with the Delta variant, which we found is more transmissible, it appears to having being more impact on kids in some cases. So it's just a lot of variables coming together, a lot of variables that are making it more challenging to operate our schools. But again, I think there's give credit where it's deserved, that we're having the conversation about this is happening. Kids are in school. You don't hear too much of the conversation about, oh, should we, be shutting down or whatnot, right? The parameters have already been set. The state set the guidelines. So it is very much a legal expectation that we are in school. And because some of the rules have changed. But with that said, I think folks are trying to navigate this very, very challenging environment.
Yeah, and we've had some members help us out and wanted to bring your attention to a couple of items that we now have on our ACSA Resource Hub. We have 3 infographics that came in from Santa Barbara County Office of Education, one on staff close contacts, and 2 on student close contacts in school settings. 3 infographics for you from Santa Barbara COE that you can use. And then Holly Eads, who is watching the show right now, everybody say hello to Holly, our superintendent from Orcutt Union School District and former ACSA president. She sent in 2 infographics, one on next steps after child has been diagnosed with COVID, and what if your child has been exposed, some best practices, all in infographic form. You can get those over on the ACSA Resource Hub. That's content.acsa.org, or you can access it from our homepage, ACSA.org. And
I'm going to take the opportunity, since you said this.
Yes.
And it won't be something that our folks will like to hear, but undoubtedly we're going to get the question. It's the state still has not given, new guidance as it relates to obviously sports, music. I bring this up when you talk about contact tracing and exposure, because one of the questions that we've pushed them, and we've pushed them a number of times, they've acknowledged that they're working on it. And this came from questions we got for the field. Okay, if the rules right now are that, let's say we're outside, right? Because the guidance right now talks about situations where people are indoors, if they're vaccinated, if they're masked or not masked, what the quarantine rules are. It's really ambiguous of what do we do when kids or students are outside, and whether they're vaccinated or not, and whether they're wearing a mask or not, are the rules different? They've acknowledged that it's ambiguous. And this obviously plays an impact on what do we do with these kids. If somebody came in to meet the definition of 15 minutes with 6 feet for more than 15 minutes, are we supposed to send them home, right? So unfortunately, we don't have answers yet. Mm-hmm. I bring this up to just let you know that we're pushing so that they're going to stop taking our calls at some point, right? Just tired of hearing from us. But we're really trying hard to express the angst that you and your families are feeling in the absence of real good direction, especially on this front.
Hey, I don't mean to just put this out there, but you said you are going to get tired of taking our phone calls. I have now been ghosted by many a person who might be in the knowledge area on some of this stuff. So I am starting to take it personally for those of you who aren't responding to my phone calls. Hey, let me point this out. And I don't know if Gianna put this up on the screen, but I just want to point this out. Sarah Noguchi, who is over at Modesto City Schools, has a comment here. A ton of contact tracing. You and I are going to mess that up.
With that too, yeah.
A ton of contact tracing and many students quarantined, ramping up student testing and training 10 more contract tracers. Folks, if you're out there and you're in the process of also having to train more contact tracers, go ahead and throw it in our chat. We'd love to know what you are doing, what some of the best practices are for you guys, because this show is not just about educating the educators with the two of us, but also, giving you guys the avenue and the pathway to do that. Let me give this one piece of good news, and I'm going to go ahead and shout out to our great educators over at Oxnard Union High School District. We have a story that's in EdCal coming up this week on a Region 13 student, Pedro Calderon, who has earned 21 scholarships, a total of $230,000 in scholarships, Edgar. That includes $40,000 from General Electric and Ronald Reagan Presidential Foundation and Institute, $30,000 from Lockheed Martin, and $20,000 from Coca-Cola. I don't know what they're doing over at Oxnard Union High School District, Edgar, but I'm impressed. 21 scholarships and that amount of scholarship funding, that's impressive.
That kid is hustling. I gotta say, that student could teach a course on, going and soliciting scholarships. So yeah, no, that's awesome. I love some good news, especially when Naj and Edgar come on and, or Debbie Downers here on so many things.
Hey, you know what? With me having a freshman and you having an 8th grader, if I remember correctly, you and I could use a little education from Pedro Calderon. So Pedro, if you're out there, you should really start some type of a virtual course on this. All right, so let's go ahead. Let's switch topics over here. We've got a couple of guests for you. Of course, we had the governor's vaccination mandate for educators and all public and private school employees here in the state come out last Wednesday. And we had almost 40 questions from our viewers last week. We do have a little bit of a switch here on the topic, but something we think is very important for you. So let's bring in our guests. Gary Reller is the principal over at Matthew Gage Middle School in the Riverside Unified School District. One of our great participants on this show. Of note, classes at Matthew Gage Middle School started on August 6th. And then Katie Nilsson, Director of Medicaid Compliance. She's a registered credentialed school nurse over at San Joaquin County Office of Education. Gary and Katie, it's an honor to have you here on the show with us today. Katie, let me start with you. As Medicaid Compliance Director over at San Joaquin County Office of Education, what are the challenges that you see that schools are facing as we open this semester? What are you seeing as far as the interactions with students and parents, and how are you and the staff kind of attending to students' unique needs amidst this pandemic?
So I'm going to thank you for having me. I'm going to talk to you as a credentialed school nurse and my opinions and what I see from that angle. But I will agree with you, and this has already been talked about. I think one of the biggest challenges is the CDPH K-12 guidelines and basically the interpretation and implementation of those guidelines, especially surrounding the quarantine and testing, right? You have the difference between vaccinated versus unvaccinated. What's a modified quarantine? When should the students be screened, and when can they discontinue their quarantine? I mean, and I think Edgar used the term ambiguous. So they definitely are ambiguous guidelines. So that's one of the biggest challenges. As far as interactions with our students and parents, we're a fairly large county and pretty diverse. We have some agriculture, we have some cities. So it really depends on who we're speaking to within those populations and, what they are deeming, important to them, whether it be vaccine, whether it be, quarantine, things like that. And especially with our population here in our county, we have a mod severe special education population. There is a lot of concern that comes from our parents regarding those students. And that kind of leads me into the last question about, identifying the unique needs. Some of our students do have underlying health conditions or certain conditions, especially in our moderate severe special ed population that we really need to get on top of. So making sure that you're including your school nurse, right? They're your health expert in your school setting, and they speak the language of healthcare, right? So they can talk to your public health officer, and they can talk to the parents and make sure that they're putting in plans in place to make sure that all of our students are safe at school.
Gary, kind of changing the perspective, looking at it from a site administrator there. I love the question right now, just when we ask to any of our leaders, because back to school season right now is not your traditional mom and pop, like back to school, right? This is all very different these days. So I always have to ask, how's it going? How are you dealing with the communicating as it relating to all the different rules that Katie was talking about, the mask mandates, all the things that are controversial in the community? And, given that you guys have been open and we have a lot of schools coming online here this week and over the next couple of weeks, any early advice based on this preliminary assessments that you've made?
Well, first of all, Naj and Edgar, thank you so much for inviting me. As you know, Riverside Unified School District was one of the few school districts in Riverside County that made it back to in-person instruction last year. And through the leadership of our Board of Education, our Superintendent Renee Hill and her cabinet, we have been able to communicate to our families through last year's return to in-person and communicating with them about what the potential for returning to in-person instruction will look like next year. We have a communication plan that is shared with all of the site principals to help us cascade that information to our families. As a matter of fact, what we'll do is we'll send out school messages via text. We'll send them out phone. Parents will get things from me. They'll get things from the school district. We've been over communicating the CDPH guidelines. And I can tell you that our parents have been adhering to those CDPH guidelines. We haven't had a single student that has refused to wear a face covering during instruction.
Let me just address a question. Mike McCormick, I see your question. We will get to that in just a moment. Edgar, tell me if I am correct here. Michelle Murphy asked the question, we have seen and heard two opinions regarding vaccinations and testing. Do the unvaccinated have to test twice a week or weekly? I thought it was twice a week. Am I correct with that?
Yeah, and good thing, you filibustered just enough. So Surratt, who's our real expert here behind the scenes, just got on and did confirm that yes, that unvaccinated need to test 2 times weekly.
Well, let me ask both of you, and Katie, I'll have you respond first to this. One of the things that CDPH guidance outlines is that schools and LEAs should have a COVID-19 liaison to assist the local health department with contact tracing and investigation. So how is this being handled at the county office of education level? And then Gary, maybe you could talk about it from your district and from your school itself. So Katie, let me have you start.
Sure. At our county office level, we are using our licensed, registered, credentialed school nurses. So for staff, that comes out of the office that I work in, which is our comprehensive health department. We do also contract with an outside agency, but they are a licensed registered nurse. And then for our students in our specific programs, the contact tracers are the school nurses assigned to those programs. I think that it's important that it be a licensed nurse because we are able to assess and interpret what is going on with each individual case. And then we also are meeting at our county level twice weekly with our public health officer and her lead contact tracing nurse. So we have that open dialogue with our public health community. So it's great.
And Gary?
Well, as everybody knows, and you've been at board meetings or watched them on the local news, this is a pretty hot topic with respect to the CDPH guidelines and mask wearing. And our Board of Education on August 5th actually passed a resolution that it requests the state of California to expeditiously revise COVID safety guidance for K through 12 schools to account for local conditions and risk factors. So our board has worked hand in hand with local health officials as well as our community. With respect to the school site, contact tracing is huge. Riverside Unified has a COVID-19 nurse assigned to each cluster. And as a school site leader, once I get notification of a potential exposure or positive case, anything, all I do is I notify that nurse, and that nurse takes it from there and lets me know what I need to be doing. Sure, we have the plan and the protocols, but we have been given the leeway not to have to deal with that on a day-to-day basis, the contact tracing. We have another individual that does that. So we can focus on instruction and focus on having a great experience for our kids.
There's a question to both of you. The guidelines, as the topic of the day, seems to be contact tracing, and I feel like this is going to be just all of our worlds here for the next couple of weeks, and hopefully the surge at some point will get better, and maybe it stops being so much in our vocabulary. But unfortunately, it's our reality. And so the guidance talks about the LEA, the school district, needing to have a liaison to both. I think it says that has to deal with contact tracing and investigation. So I'm just curious from both of your perspectives, both at the county office and then at the site level, how is this working out? How is this being handled in your respective LEAs? I'll start with Katie.
I think it's going well. It's obviously a lot of work, contact tracing, and with the increase of our population between ages 5 and 17 coming up positive with COVID, for the school nurses, it's challenging, but it's doable. So it's going well.
Gary?
I'm very fortunate to have an amazing office staff that works together. So it's not only my health clerk, it's not only my isolation room health clerk that are working on ensuring we communicate when we have a student that could potentially be exposed, and then start that process of contact tracing. We have a document that is shared among all of our staff in the office to ensure that when individuals call to let us know, we document that. We send that information to our health clerk and our isolation room health clerk, as well as the cluster nurse, who then takes that information and starts the protocol. And that nurse lets us know then, one, is that student returning to school, or two, that student is on quarantine for a certain number of days. Like I said earlier, it takes a lot of the pressure off the site principals so we can focus on what we need to be doing here at our individual school sites. And I can tell you, as Katie said, it is a lot of work. And I can't tell you how much I appreciate our COVID-19 nurses and all our healthcare professionals in Riverside Unified, because if it wasn't for them, we'd have a really difficult time.
Folks, if you do have questions out there, go ahead and drop those into our chat. We do see a number of questions that have come in. And again, we have Saret Kaminsky, who is the expert on this behind the scenes to answer some of the questions that come on board. At the top of bringing you guys on today, Gary, I had mentioned that classes over at Matthew Gage Middle School have been going for 7th graders since August 6th. Because this mandate came in after the school year began, what are the questions that you're hearing about the vaccination mandate for educators, and how has it been received at your school and in your school community before and after now the mandate has come out?
Well, I need to start by just letting you know, when the vaccines became available, all of the staff here at Matthew Gage Middle School, we immediately started a phone tree, text tree, whatever tree you want to call it. And anytime we got an inside track on some vaccinations, we sent that out to our staff. And I can tell you that a large number of our staff is vaccinated. And with the vaccine mandate, I can guarantee that we're going to have more staff going and getting vaccinated, or they're going to take the test. But to be honest, I haven't heard any rumblings about the vaccine mandate from my staff. Sure, there might be some emails going back and forth behind the scenes, but I think all of our teachers and our staff here at Matthew Gage Middle School are on board to make sure that our school is safe for them as well as our kids.
Hey, Katie, let me direct this question to you. I know that we were getting a couple of inquiries. I think Kathy Parker and a few others touched on this notion. Maybe you could tell us from your experience how you folks are handling this. When people are having to quarantine, what's kind of the protocol? You talked about the modified quarantine, which I know has been there's been a lot of chatter about that today in terms of when students can return, when employees can return. So maybe you could touch on that just from your experience and your expertise.
Yeah. So if they are, how I interpret it and how we've talked about it with our public health officer is they need to be, if they've been identified that they have been exposed, then they need to, and they're still asymptomatic, they can remain at school, but they have to be tested twice weekly. And that means that they should be tested immediately to see where they stand, kind of as a basis, and then twice weekly after that. So, and it's really hard because you can't tell a student to be exposed on a certain day, right? So you're going to be having these staggering days of when you're going to be screening these students. And it's a lot of work, but it's doable.
Gary, let me ask you this because this came in from Lisa Lamb on Facebook. She's asked specifically, how large is a cluster?
We have 2 middle schools, 1 comprehensive high school, and about 5 main feeder elementaries, with a few that are, a few kids come from those. But for the most part, 5 elementaries, 2 middles, and 1 comprehensive high school.
Okay. Let me ask both of you this question. The emergence of the Delta variant obviously has changed the way that we're interacting and really thinking about COVID-19. Are you seeing increased levels of concern from students, parents, and staff? What is that discussion like? Katie, let me have you start. What are you hearing?
Again, I touched on it before. It's just dependent on which part of the population that you're talking to. It could range from a lot of concern to no concern at all. So again, we are close to 50% vaccinated in our county, which is great, although our levels are rising. I can talk to what our county office has done for our vaccinated employees, that we've gone back to masking while we're in the office and around people. Obviously, I'm not masked. I'm in my office with my door closed, but if I walk out of here, I have to put my mask back on, and that's just the way it is. So so it just depends.
Gary, same question, but let me add to it about the whether you're seeing the increased level of concern from students and parents and staff. As a result of this, are you seeing more parents and students pursue that independent study option, whether it's in your school or just maybe anecdotally what you're hearing at the district level?
Great question. Last year when we reached out to our families and asked them, do you want to attend in person or virtual? We did that fairly early in the year. And then as our numbers got better, we knew that parents would want to return to in-person instruction. So at Matthew Gage Middle School, we called every single one of our parents that chose the virtual program for this year. And we got probably 75 of those families that said, I'm going to go back to in-person instruction. Now, fast forward to current year. Right now, we have less than 5 families that have chosen to transfer from in-person instruction to virtual, and we have over 15 families that have chosen to go from virtual to in-person. And if you look at my COVID-19 dashboard, I have 1 case in the last 14 days. And of course, we have mandatory notification to our staff and families. And my front office staff, as well as the teachers, are well-versed in those safety protocols that we have in place. And our community is very comfortable with everything we're doing to ensure our children are safe.
I saw that Surratt and the team were helping there with a little bit. I think Gianna is actually going to help with some of the resources. We did get a question about parental permission and testing. So maybe I'll briefly just ask both of you how you've been dealing with that in cases where you have to test. I know we're going to put out the resource that CDPH has put out. I think they have a template on what you need to secure. But Katie, maybe you want to touch on this, on how you've been dealing with that piece of it.
Yeah, so our screening is we do it through our HR department, and if it's students, we send home the permission, the consent form, and they come back with it signed, and we screen them right there, and we're able to send it for results that same day.
Gary, I was really, you made that remark earlier about making the connection, making the phone calls back to some of those families, and I witnessed my wife and her colleague, as many of you know, she was a kindergarten teacher, doing that very same thing to reconnect with those families who had been in the distance learning environment and seeing where they were as far as coming back to school this year. So yeah, I'm sure that there are a lot of districts and a lot of teachers that have done that. Let me ask both of you as we wrap up, and Gary, I'll have you start. After such a tumultuous year that we had last year, what were some of the lessons learned through that you've been able to bring to this year to help guide you as we chart this new Delta variant and anything else that comes with COVID-19. Gary, I'll have you start.
That is an amazing question. I can tell you that there's one thing that I learned how to do during the shutdown and when we came back to in-person instruction, that is a valuable tool to an administrator as well as teachers. It's home visits. My assistant principal, Susie Jaggers, and myself did over 350 home visits last year. And we get to know our kids, our families, where they live. And that is a practice that we will continue for the rest of my career because it is so important to know our students' stories and our family stories. So home visits, that is the thing that I learned. Matter of fact, the other day I did a home visit.
And Katie, what have you learned over this time?
I think that's wonderful, Gary. Thank you. And I'll kind of piggyback on that with just checking in with students and staff. This has been such a stressful time and our mental health is so important. So, we've seen an increase in depression, anxiety, suicide rates, things like that. And knowing that children often present with psychosomatic symptoms like stomach aches and headaches and things like that, before we know that it could be an underlying issue of depression or anxiety or something, making sure that we're checking in with them is so important. And another thing I've learned is how to pivot, right? Things change so much and so often that you might be thinking that you're going one way and then all of a sudden it changes and you have to quickly pivot and go the other way. So,
Katie Nilsson, Director of Medicaid Compliance at San Joaquin County Office of Education, Gary Reller, Principal at Matthew Gage Middle School in the Riverside Unified School District. Katie and Gary, it's been an honor to have you on the show. Thank you so much. Have a great rest of the day.
Thank you.
Thank you.
Edgar, let me see if I can go find. We had a question that came earlier. Give me just a moment here, folks, so I can go back through our chat. Hold on. I'm getting there. Here we go. Mike McCormick, Superintendent, Valverde Unified School District, asked the question, and Edgar, I'll pose this to you. Is there any guidance on meeting the requirement for capturing vaccination status of our employees? For example, first name, last name, date of birth, name of vaccine, date of vaccines, etc. I don't know if you know that offhand or if we want to throw that over.
I'm trying to remember, and I'm sure the team will jump in there if there was something we forgot, but I don't necessarily, I'm stand corrected, that in the guidance, and we'll post this, that I do believe that they give some general guidance on what you need to capture and how you need to capture it. So we'll post that link from the CDPH guidance here in the chat.
There you go, Mike. See, we made you wait the entire show. You were one of the first people to put in a question. We made you wait all the way to the end of the show. But Mike, it's only because we love you and we wanted to keep you on here. Edgar, as we wrap up, any thoughts on this? I know you had talked about we still don't have anything on youth sports, but it seems like there's so much to this particular piece about the vaccine mandate and how districts are going to get everything in and complete by October 15th. It seems like there's a lot ahead. You've said breathe, but it seems like things are rapidly changing.
Yeah, here's the thing. I'm going to make a prediction here. We're going to be talking about here in the coming weeks, just in general. There's going to be a lot of conversation about, yes, at some point, the state is going to put out this guidance on youth sports, extracurricular activities, music, arts, and I'm sure it's going to cause some reaction, and we're going to have to help translate that. So that's one issue. We do know that the state is working in some respect on clarifying some of the exposure rules. Is there a difference between indoor and outdoor, and how should that impact the quarantine periods? I think that's going to be a component. One of the things we didn't get a ton of questions, but I know there's still a huge level of angst is independent study. Now, specifically for those students that are going into quarantine, though, the quarantine looks different than it did last year, right? And I know some districts are challenged with, Okay, if we're having a quarantine, but we don't have the ability to just transfer back and forth, okay, you're going to essentially Zoom from the room, if you will, what folks were calling it. And I know there's some restrictions on that, or collective bargaining agreements are against that in some places. Well, what does that mean? That means that kids then may have to rely on paper packets and whatnot. And I know that there's going to be some angst among parents if that's the case. And the fact, if we're having to quarantine students, this many of them, that it may lead to more desire to, well, I'm just going to choose the virtual option because at least they'll be consistent, right? So this is some of the themes, general things I've been hearing over the last number of days. And I think we're going to highlight some of this to the state and to the policymakers. And these will be some of the conversation we'll be having in the weeks to come.
Yeah, I mean, I think that statistic that we read near the beginning, that recent study indicates COVID-19 cases among children and adolescents under 18 has increased 421% from early June till late July. I mean, that says so much just in that number right there, that data point. So certainly something that I know lawmakers are probably going to be working through over these next few weeks. Edgar, good to see you, man. We're halfway through the week, folks, and Edgar, we'll see you next week.
Always fun, Naj. We'll be back next week.
Thank you, folks, so much for joining us here on the ACSA Legislative Lunch Break. We'll see you again next Wednesday, 1 p.m. live and interactive here on ACSA Facebook and ACSA YouTube. Have a great rest of the day and great rest of the week. We'll see you next time.